Okay, hello, my name is Karen Cherito from Kenya Red Cross Training Institute, and the video that you're about to watch is a video about extrication of a patient after an accident has occurred and the patient still remains seated in their vehicle. So the team that is going to take us through this in the video that you are about to watch is a team of medical personnel from Kenya Red Cross Training Institute. So we are taking you through the steps that should be taken when a patient is trapped inside their vehicle.
The first step of extrication is to ensure scene safety. And under scene safety, it is important to make sure that all road users understand that there's an accident ahead, and therefore what is happening is you put lifesavers and check under the vehicle to see if there are any other threats. Check around the vehicle and ensure that the scene is safe. You will also chock the vehicle. Make sure that depending on the terrain, it cannot move forward or backward for the safety of the rescuers. Another thing is you'll have to look at the access, gaining access. Do you have simple access, or in terms of gaining access, do you have a complex access? So once that is assured, you go for the easiest access, in this case simple access. Then you move to the other step of now checking at the patient. What you are seeing right there is now assessing the patient's the level of consciousness. You also go and check at the airway, breathing and circulation. Then there is checking for pulses, sensory and motor function in both the upper and the lower extremities. Then you do a quick rapid assessment from head to toe, ensuring that the patient is okay from head to toe. So that is what is happening there, all in the best interest of the patient, because again you don't want patients to have a damaged spine. So you want to be assured that from the word go your patient is okay, or if not okay, then in the principles of giving proper care to the patient, you don't want to cause more harm. So that is what is happening there. So the rescuers, the paramedics are ensuring that everything is intact. Then we have the supporting of the head from the back of the seat. You remove the headrest. Then now you are ready with your KED extrication device or KED vest. Place it at the back of your patient and secure it properly. So you must ensure that is well set up before securing. As you can see, the patient has been moved forward as a unit. Okay, then at the count of the one at the head, that is 1, 2, 3, the patient is laid back to the KED extrication device. So now it's time to secure it. The vest is secured from the middle, the yellow strap, bottom, the red strap, and finally the top one, which is green. So once you place them into place, the next thing is to firmly secure them, like it's happening right there. Then of course the other aspect now is to ensure that you prepare padding, the padding for the groin region. That is what is happening there. so that now we can secure the groin region and place the ischial straps again, so that it cannot injure the patient in the process of securing the vest, the Kendrick extrication device. So there we are, still continuing with the step of securing the device before now moving to the next step of now extricating and removing the patient from the trap, which is in this case the wreckage of the vehicle. So these are post-accident activities, just to ensure that patient is removed safely and taken onto a spine board in readiness for loading the patient to the ambulance and transportation to the hospital for further care. So that is what is happening there by the rescuers, in this case the paramedics. So everything has to move on very systematically, having in mind the safety of the rescuers and the well-being of the patient. And by this we mean no further injuries. So you have to minimize movement, unnecessary movement, and ensure that the only movement is now necessary in terms of removing the patient. So patient is now being moved onto a spine board in a coordinated manner. At the count of whoever is on the head now handing over to the other next person, at a count of 3, now you lower the patient systematically onto the spine board. Then at the count of 3 you slide them up again onto the spine board. Make sure that they are well placed onto the spine board. That is what is happening there. And then of course you align properly and make sure now the patient is well secured before putting them down. There we go, the head blocks. That's another very important step in ensuring the patient is well secured onto the spine board. So the head blocks there are in place. Then, well coordinated, the team leader takes over. Whoever is on the head always takes lead in terms of command. The patient now is in a coordinated way placed to the ground for further stabilization. So coordinated steps there. And then of course at the count of the team leader, you rotate now and place the patient to the ground. So then of course you move to a secure place far from the scene of incident a little bit. You have to coordinate your steps, and then now you place the patient down, taking care of your backs again, not to self-injure. So further securing of the patient. So we have the strappings, commonly known as the spider web, which is now securing the patient onto the spine board before loading them to an ambulance. So that is what is happening. It has to be well done, so that again, to avoid dropping your patient from the spine board when you are moving. So starts from the bottom to the middle all the way to the head. You secure the head last. So that is what is happening. So if you don't have the spider strappings, you can use any straps available, whether commercial or improvised. But in this case we have the commercial straps available. So the next thing here is to move this patient to the ambulance. So the patient will be moved to the ambulance. Once the strapping is done, so we are in the second last step of the extrication steps, because the next and the last step is to load this patient to a waiting ambulance, so that now the patient can receive further care in transit to hospital. So just making sure everything is in order. Now the team leader again will take over to coordinate the lifting of the patient from the ground all the way to the standby waiting ambulance. So again, it's a coordinated procedure. Then of course you agree and you move to.
So thank you so much for watching the video. I hope it has been an educative video. I wish you safe driving and stay safe. Thank you.